Imagine that your neck is just made of melted candle wax. Hi, it's Anne from Posturally, and I want to talk just a little bit about why I think the creative approach to chronic pain release and relief and building the body into functionality is the way to go. And before I do that, I need to give you the caveat, the elephant in the room, where if you have an actual injury, whether that's like a herniated disc, or you sprained your ankle yesterday, or you have a flare-up from a condition that is medical, it is important to work with your licensed, qualified medical provider because they are trained and equipped to help with that specific thing. The work that I do is for people who have had pain for a very long time, and sometimes it's connected to that injury, but in that case, if it is, this work is an adjunct that can be fantastic. But I've had many people who had injuries and went to physical therapy, and the therapy helped a little bit, but they were never quite the same, or they just had pain and never went anywhere for it, and it's been going on for 20 years. And these are the people that I work with a lot and get excellent results. So the reason I like the creative approach is manifold, really. First of all, we work quite anatomically, which gets us really good results really fast. Now, when I say anatomical, I am not taking you back to college where you have to memorize jargon and you have to go look at cadavers and you have to take quizzes. This is not what we do with my work in Posturally. What we do is we hone in on areas. Sometimes we learn a little bit about it with books. We have nice pictures and stuff. But we'll do things like imagery for an area. For example, one thing I love to give to clients is what I call the melted candle image. And this is great if you sit at a computer. And what it is imagine that your neck is just made of melted candle wax. It's not even placed on top of the neck, but it's made of melted candle wax. And that wax is malleable and soft. And because your neck is long and maybe you're sitting up or you're standing up, the wax drips downward in the direction of your feet, softening and lengthening the muscles as it goes. And try that on the exhale a few times, maybe up to 10 times. Don't do it when you're driving, please. Don't do it when you have to drive. And if you have some type of dizziness in your medical history, it may not be the thing for you. So you want to use your common sense. But doing this, the brain is being talked to with the image that is connected to the way the anatomy is. In this case, muscles that go downward. Generally speaking, that's not exactly true, but it's close enough for what we want to do. And as we talk to the brain about how soft the muscles are, we can then start to release them. It's a subconscious process. So this is how I teach anatomy. It's the use of an image. I also use creativity in allowing my clients to express themselves, encouraging them to express themselves. For example, I had a client years ago who was a singer, and she took up singing because she was kind of wanting to get out of her shell, right? And we healed up her back really good with all the movements, the correct movements for her body. And she was just she would come into the session and she would just, because she was using the same muscles in singing as she was for getting her back strong that I would teach her. And the singing just helped her unlock her entire being in the experience of healing the body. So this is another use of creativity. And finally, a third use. There are many others, of course, but I like to encourage people to journal, make art, because when you get injured, it's true that we go to the doctor. A lot of people do it too much. That's a different story, different video. But we will have to go to the doctor. He's got 15 minutes. You should take a drug. You should do a surgery. And don't expect ever to be as good as you were before. But they won't tell you that until after they do the surgery, some of them. So in this work, what we want to do is take into consideration the entire whole person that you or I or whoever is doing the work is, and really kind of process through, well, I was on the road, I'm journaling through, I was on the road to healing, and then this happened, and then I had to stop and do all this stuff, and now that pain is back. Or my pain, On my shoulder here, the front, it looks green to me, but in the back, it's kind of linear. There's a lot of little lines, and drawing a picture of that. All of this helps the brain to process the healing and bring it closer and further into who you are and what you are, so that you can release the pain and release that identity and move forward with living a pain-free, functional life.